This is one of my favorite things to do over the summer. I love talking to people first off, and I really love helping people. And it's much more of an outlet. When I'm at work, there's things to be filled and things to be rung up, and doctors and phone calls going all the time. And it's really hard to sit down and really talk to someone to really answer their questions and validate their concerns. And this is why I love being here. They'll tell you about their medications. They'll tell you their story. And these people are just so interesting to listen to talk to. And you really are able to put a story behind the face that you're helping. It's not just a name on a label anymore, it's a real person that's there.
They bought a lot of medications with them and they didn't know half the medication, why they were taking them and how to take them, and there were a lot of problems in that. So one patient had 3-4 blood pressure medications, and she didn't know why she was on all these medications. So it was a good opportunity for us to explain to her how each medication works, and then why the doctor put the patient on those medications. So in that case, they could understand and get an idea as to why they have so many medications just for one problem.
The pharmacist is the bridge between the doctor and the patient. When you go into a physician's office, they are the people that are going to diagnose you with the disease state. And they prescribe a medication that's going to help that disease state. From there, you get very little education about the drug. That's the pharmacist's job. Pharmacists are trained to counsel patients. The questions really are 3 prime questions. What did the doctor tell you this medication was for? From there, you ask them, how did the doctor tell you to take this, to make sure that something was said in the office. And a lot of times when I ask that question, patients say, I don't really know. The doctor saw me so quickly, I don't even know what he said. And the last question that we're trained to say, maybe in different words, but is, what do you expect from this medication? And that question is really the good and the bad, because you have to tell people, what they can expect. Can I expect some side effects from this? Sure, every medication has a side effect. But if you tell them that this is expected, they're not going to be so worried and concerned when this adverse side effect actually happens. But you also want to tell them the good things. So for example, with the blood pressure medication, yes, it can cause some dizziness that may go away, but it's also going to lower your blood pressure and reduce your chances for a heart attack or a stroke. So patients should be talking to their pharmacists, and pharmacists should be talking to their patients to make people more confident that these medications are going to help them. And if they feel like they're hurting them, that there are options. There are other options. One of the students was saying, we know those other options.
We're making recommendations that they could actually go in and discuss with their physician, because we are not privy to all of their health information. We only have a snippet of what they're willing to share with us. Based on what we have, we can make suggestions as topics or questions they could, ask their physician about. Just this last person that I just had really felt we made an impact, because she was actually able, there's a lot going on with this particular person, and she also has, issues with, I wouldn't say, mood and depression, and just being able to communicate with her about her medications and clarifying that particular aspect of her life really helped her. She said this is just phenomenal for her. So I think we really made an impact on her. And there was this gentleman who had several blood pressure medications, and very healthy, led a very healthy lifestyle, was considering stopping their medications. But this particular person, their dad died very young. His grandfather died very young. So him not controlling his blood pressure would have been a very huge issue for him, although he's very healthy, because of that high risk that he has in his family.
It was a great event, actually. The main thing that I felt was that the patients were very appreciative of what we actually did for them. They don't really get a chance to talk with their doctors or other healthcare professionals about all their medications, and they don't have a true understanding of what they're taking, why they're taking it. And I feel like when they leave, they're very appreciative of what we have, the time that we took. That's all, just the time that we've taken to explain to them what they're actually taking. You learn something new from every single patient. So just the interaction is a huge deal to learn from. So every patient is different, and we learn from every patient. The conversation flows, so it doesn't feel like an hour. In fact, you look at the time, you're like, wow, it's been an hour. So it's, you can go on and on forever, because there's just so much to discuss from every patient. Every patient was a duplication of therapies. So she was taking a lot of over-the-counter supplements that all had one of the same ingredients in them, but she wasn't aware of that fact. So to like show her that the labels sometimes may be misleading can also help them to eliminate duplications. Yeah, there are adverse effects. They affect other medications as well, and also just side effects. The more amount of medications you have, the more prone you are to side effects, to experiencing side effects.
If you're in the hustle and bustle of community pharmacy, chances are you're not going to spend much time with patients. So I think to have something like this where we can spend a little more time, we can go more in depth about their medications, about how they're treating with them, are they taking it correctly, I think it presents a really great opportunity for the community. Yeah, you have people coming in and they're on this laundry list of medications, and Lord knows if they know what everything is for. And you ask them the basic questions, you know what this is for, do you know how to take it, do you know what to expect from it? And they give you these kind of vague answers, and you try to put as much time as you can, but you're constrained by economic reasons. So there's only so much effort you can put through. And something like this, it really gives you an opportunity to expound more into that. And you get to individualize with the patients, you get to go through things more in depth.
The role of Pulse and our organization is to bring together medical professionals and patients and families in the community to bridge that gap of understanding and recognizing what it is that is needed by each participant to make healthcare safe. Sometimes pharmacists or any medical professional may use really big words. We don't understand what they're saying, or we're just overwhelmed with information, and we can hear that as part of this brown bagged event. The pharmacist or a pharmacy student may ask the community member or the patient to come sit down at the table with their medications and have a conversation, but they'll also ask the person who they drove them, ask the patient, is it okay if this person comes and sits down with you? It could be very private information that the patient may want to share, and they may not want the other person to hear the information. And we just want to make sure that the patient stays empowered and is able to say, no, I really don't want my mother or my spouse or my sister or brother to sit at the table with us. I want to talk private. The goal is to encourage pharmacy students to be able to spend time with patients and learn about their needs and some of the questions and concerns that a patient may have away from the pharmacy itself. The pharmacy student now is learning their communication skills and working on their communication skills, learning more about the patient on a one-to-one. I think the pharmacy student is getting a lot out of learning about working with the patient in a very different atmosphere. A patient who doesn't understand what the pharmacist's role is not going to be an empowered patient. And a pharmacist not understanding what the patient's needs are is not going to help that patient become empowered. We want to continue including patients and families and healthcare providers in roles to work together so they can continue working together for the best outcome for the patient.